One of the first sections of the ABE application is to include information about the people who live in the home. And sometimes this can be confusing in terms of how many people are you supposed to list on the application. Whenever you have a question about anything on the application, if there you see this question mark icon here in the box that says people in the home, if you click on that, or move your cursor over that question mark, you will get more information about what the state is really asking. And so that's a really helpful feature within the ABE application. If someone is applying for health coverage through the Medicaid program, it's important to include not only the people who live in the home, but anyone who might be claimed as a tax dependent on the person's tax return. If they're applying for SNAP or cash assistance, it's really important to include everyone who lives with them. And then later in the application, depending on how you enter a relationship and whether or not they eat together and things like that, that is what will help the state make the determination. I'll show you some screenshots with that as well. So the first person you enter on the ABE application will be considered the primary account holder or the head of household, so to speak, regardless if they are the requesting benefits or not. So just think about that in terms of the order of people you include on the application. In this case, we have Anthony Soprano, and we are entering some basic demographic information. And this is asked of each person. These questions we are going to see are asked of each person that is included on the application. They do have a question, it is optional, but about what language to use if they need to contact the person. And I think this is really important for those clients who do not speak English or are limited English proficient, that if they're going to need an interpreter when interacting with the Department of Human Services, to definitely list that here and to include in the ABE comments section at the end of the application that they need an interpreter. Now you will notice the next question asks what language should they use when mailing the notices. So every time the state communicates with a client about their benefits application or case, it will be mailed in the U.S. mail. Unfortunately, right now, the only language capacity they have in written notices is English and Spanish. So if you have someone who speaks Urdu or Portuguese or Polish or whatever language, I would probably mark English unless you have someone who speaks Spanish and Polish both. That way, hopefully, they can get the letter to someone who can read the English. It's not going to help to send something in Spanish to a Portuguese speaker if they don't have anyone who speaks Spanish or understands Spanish. Now, if they do read Spanish, because we do have many people who might be bilingual or trilingual, etc., then great. But if they need help from an organization that does not have Spanish speaking or Spanish reading caseworkers or case managers, then just think about that in terms of language. By selecting what county you live in, that's going to help later direct which office the application gets sent to for processing. And these are additional questions that are asked, and it's all on one long screen for each individual on the application, but you'll put down where their street address is in terms of where they live. If they're homeless, you will mark that, but if someone is homeless, they still need to have a mailing address. That mailing address could be your organization. It could even be their local DHS office, which is known as a Family Community Resource Center, or FCRC for short. But they have to know to go and pick up the mail. Contact information in terms of phone and email address is also important. Please make sure that they have a working phone number if at all possible, especially if applying for SNAP benefits. As part of the SNAP application, a phone interview is usually required, and many offices are able to process that and do the interview very soon after the application is submitted. So we want to not only provide a working phone number if we can for the person applying, but also to let them know that they may be receiving a call if they're applying for SNAP. In the future, we're very excited. The state is hoping sometime in 2022 to begin to text their clients, their customers. So if they have a cell phone that can accept text messages, it will be important to make sure that is included on these applications. Just a quick side note about text messaging, it will be very simple reminders. It won't include a lot of information that is confidential, but it is a new strategy that the state is hoping to implement sometime in 2022 so that they can help their customers maintain their benefits. And then for each individual on the application, you will check which programs they are requesting. So in this case, we have Anthony Soprano, who is only applying for health coverage, but perhaps he has other family members who are requesting SNAP and cash assistance as well. If Anthony was undocumented and applying on behalf of his family members, we would not check this box at all. He would not be requesting benefits, right? But he needs to be on his family's application so that his income and relationship can be used to determine their eligibility for benefits. You will also see a question if someone's applying for health coverage, a medical benefit choice, whether it's aid to the age blind disabled or family care or ACA or no preference. This is probably most relevant to those adults with disabilities who are not yet receiving Medicare, because they can be put into either the ACA adult program or the AABD program. And so if they have a strong preference about which program they should be assessed under, this is where they would indicate that choice. If you're interested in more information about that, we can give you some more resources. Many applicants may just choose no preference for this section, but they do have the right to choose which medical program. The reason is there are different rules for income counting, whether it's an AABD or ACA application, and it is a federal requirement that the state gives this population a choice in what program they're applying for. You can see a further explanation about who these programs cover in the right, which is really the screenshot or the window that pops up when you put your cursor over the question mark on this part of the application. Some additional information that is collected about each applicant. It will ask whether or not the person is planning to file taxes. The tax questions are really related to the Medicaid program, not SNAP or cash assistance. It will ask for a Social Security number, but if someone does not have one and they are not requesting benefits, they do not need to enter anything here. If you have an immigrant who has an ITIN, which is an individual taxpayer identification number, this does not get entered here. It's only for those who have a Social Security number. You also will see a couple of other questions about citizenship and veteran status. Let's take a closer look at those. These are the questions that show up as soon as you mark no, the person is not a citizen. The first is asking whether or not it's a request for emergency medical assistance for a non-citizen. This is a special Medicaid program for immigrants who do not have a qualifying immigration status for Medicaid, but end up in the emergency room for a life-threatening or sudden onset illness or injury. So that's a special program that if they're requesting that benefit, they can do so through this ABE application. The next question is asking whether or not someone has a sponsor. Now, you and I, if we are helping an immigrant apply for benefits, we may not know if the person still falls under sponsor liability. This is a specialized rule related to SNAP and cash applications, where if you have a qualified immigrant who is now seeking SNAP or cash application, they may have to include their sponsor's income. But you and I will never know that. It's only the state worker that can make that determination. So when in doubt, if you know that the person is an immigrant that entered under family sponsorship, perhaps, I might just err on the side of caution and mark, yes, the person has a sponsor. That's the only place we mark it on the application, and it's not like it asks for more details about those sponsors later. That is something the state worker will request once they are doing their checks within their electronic systems. Again, it only applies to SNAP and cash. Sponsorship does not apply for Medicaid applications, meaning they will not need a sponsor's income for Medicaid applications. You'll also see that they do ask whether or not the person is a documented non-citizen or not. And I know that that can be kind of a scary question for some immigrants who are without status to answer. But it is important, to think about we do have children who are eligible for all kids regardless of immigration status. And so if the child is undocumented, we do want to mark that because it really pulls from a different pot of money behind the scenes. It's state funded Medicaid for those undocumented children. Same thing with moms and babies coverage for pregnant people. There's no immigration status requirement there. And also now for immigrants age 65 and plus, or 65 and older. And starting in May of 2022, immigrants between ages 55 and 64 as well. And so the state has made a lot of exceptions with their Medicaid coverage. And this question is important to answer correctly because if someone does have a status, we want to make sure that we are getting the federal funding for those with status. And if they do have status, we need to enter what documents they have. If they have a green card or a work permit, or if it's an I-94 kind of arrival departure record. We want to enter their USCIS number, or some old language for that is called the alien registration number. We want to enter those documents and that information that we have because that information is important for the state worker to run their eligibility check. And these are the questions that if you mark yes, the person is a veteran, some additional questions come up. Part of this is related to the fact that DHS does have a policy that those immigrants who have served in the military or who are veterans and their family members may be able to qualify for benefits. Each household member has the option of selecting what their ethnicity and race is. They are optional questions, but can be helpful demographics for the state to collect. And then these are some questions. If they are a resident of Illinois, that's important. To receive state of Illinois benefits, you must be a resident of Illinois. There are a couple of other questions related to migrant farm workers. And then also whether or not someone has ever received benefits in another state. So just do the best you can to fill out these questions based on what your client is telling you. It will ask if anyone in the home who has identified as female is pregnant or has been pregnant within the last 3 months. This is just because there are different income counting rules for pregnant people. Also, as I mentioned, with immigration status, people who are pregnant, there is no immigration status requirement for Medicaid. And so if someone in the home is indeed pregnant, we would mark that, and then they would want some information about the due date and how many babies are being expected. This is because for the Medicaid program, that unborn baby actually counts as a household member when determining income eligibility for Medicaid. The unborn baby does not count for SNAP or even TANF in terms of the amount of benefits awarded. But if someone is pregnant, that does convey eligibility for TANF in the category of being a pregnant person. So depending on how many household members you have, you will have entered all of the questions I just went through about each person. So you'll be repeating, what's all of the language and immigration status, etc., for each household member. Once you've entered all of those, then you will have to indicate the relationship to each person in the home. So these are your options, all of the different family relationship options. So in this case, we might mark that Anthony is the spouse of Carmela. It is asking whether or not Anthony and Carmela buy and prepare meals together. This is a SNAP household question. Some people, regardless of whether or not they eat together based on their relationship, they'll have to be included in each other's SNAP unit. Whereas others, if there is no relationship and they do not eat together and they live together, then they might be separate households. So it's really relating to those SNAP household rules. The question about whether or not Anthony is able to buy and prepare meals separately from Carmela is also a SNAP question. It relates specifically to a special program, elderly, homebound, and disabled. Also, whether or not Anthony is filing taxes jointly with Carmela. And this is a Medicaid question, getting at household income rules for Medicaid. And then again, you'll indicate relationship to each person in the home. And this will help the caseworkers figure out whose income counts for each person on the application. Tax filing status is important for almost all of the Medicaid programs except the Aid to the Age Blind Disabled, health benefits for immigrants aged 65 and older, and even Illinois foster children coverage. So it is important to indicate the tax relationship and whether or not anyone can be a dependent, and if yes, whom and what the relationship is. Medicaid uses a blend of tax filing rules and relationship rules to figure out who's in each other's household. This is something that the Federation offers in terms of training, is some deeper dives into Medicaid eligibility. So even though we provide that training, I can never emphasize enough, it's really filling out these questions on the application that allow the state worker to make that determination. So it's not up to us to decide how they should be filing taxes. The client needs to tell us how they do so, what their relationship is to each other, and it's filling out this section of the application that will allow the caseworker to count the income appropriately. So again, the first section, or the first major section of the ABE application, really deals with the household and people in the home. There are some additional questions that I've not shown you for this section, but asking whether or not anyone is disabled in the home or receiving home services through the Department of Aging, whether or not anyone had received foster care services or aged out of the foster care system. And to be honest, I am recording this presentation on December 16th, 2021. We did have a recent change in Illinois with regards to drug felony conviction history and eligibility for cash assistance. I do not know if those questions will be or have been removed from the ABE application, but we're very excited as an advocate community that that is no longer a factor, whether or not someone has a drug felony conviction. If it's still there, again, you fill out the application truthfully, but hopefully they will be removing that question in the future. At the end of each section, you will see a summary of everything that you have entered on the application. And so this is a good opportunity to review with your client that you have captured everything correctly. I don't know about you, but sometimes I transpose numbers. Someone will read their number to me and I might flip them around. So it's a good idea to just make sure that we've captured everything correctly. Now, after this first section about household members, you will get a screen about verifying identity. This is an important step if the client is going to want to be able to use the Manage My Case customer portal. Again, if you're interested in learning more about Manage My Case, please refer to our other recorded PowerPoints on our website, and I will give you that information at the end of the presentation. But it is not required as part of the application itself. So you may actually try to verify the identity, but it's done through the credit history of your client. And if they don't have much of a credit history, they might not get through this electronic ID proofing process in real time. If that happens and you weren't able to verify the identity, you can click Verify Identity later and still continue with the online application.